I have another question that came from someone who submitted one before the event. It was submitted via email. And it might be a question for Mike or Ron or John or Gail. It's kind of an interesting question. It asks us to imagine the day when, in fact, a majority of the U.S. population has adopted personally controlled health records. What kind of impact would that have more broadly on the system, potentially, do you think? I mean, it's a little bit hard to put ourselves out there and imagine this circumstance, Mike, but could you see how that would be a catalyst for other change?
I think you need a great deal more transparency in the system than you have right now, and that's one of the real problems. Is you can't even do any accounting in the system right now because of the variation that you have. You'd never want to necessarily wind up paying hospital billed rates because no payer pays billed rates, and no individual pays them unless they never ask the question of, can you do me any better than this rate that you've charged me if you pay billed rates? But you need a great deal more transparency in the system, and I think having that kind of medical information helps drive us toward more transparency in the system, and that infinitely is in the best interest of having more accountability for what we're doing, what we're being compensated for, what outcomes we're getting in the healthcare system. It's all part of having that kind of personal information. But that said, there is a huge value that goes beyond just so as we talk about personal information. It is the information that we gather from having robust medical record databases that can be attributable to a particular case, even its individual identifiers that keep them anonymous, that we know if we treat people a certain way, we get certain outcomes. And that's all part of having that personal record database, but it's part of the large, robust medical database that allows us to make sure we're driving the system to be the most efficient, most effective from the standpoint of the individual, but also for the cost of healthcare.
Mm-hmm. You know, Barry, just as we're seeing medical students now emerging from school and demanding that they have electronic means by which they can conduct their clinical care, I envision a day, it's not that far off, where patients are going to demand of physicians that they be able to accept the thumb drive information that they brought with them to the physician's office and say, this is who I am, and if you can't accept that, or you still want me to carry a bunch of files or something else with me, I'm going to find somebody else who can.
More's the point. I think a secondary effect that we can't really underestimate is when you really think about healthcare and you take sort of a broad definition of it, just try to remember how much care actually happens outside of the clinical setting, particularly with chronic conditions. Most of that care management is self-administered, administered with a family member at home. And what you're really looking for is some kind of guidance to help you there and then, as opposed to when you're in the physician's office or seeing the nurse manager, nurse practitioner, or even your trainer and your diabetes coach. And that's where personal tools operating on your individual personal health information, whether it's examining your blood glucose readings for the past couple of weeks, or taking a look at your peak flow metrics for the day, and taking into account the weather, the temperature, the pollen count. All of this is really only enabled when you have personally controlled health records and the choice to pick the tools that work best with you. And ultimately, the broad system effect is to put people more in touch with their care management, make them better care managers of themselves, and ultimately live healthier, longer lives, and secondarily drive costs down, which may be personally important as well if you're paying personal dollars for healthcare.
I just want to say I love that vision that you just described, and I would just say that the information that is collected as part of an individual's management of their own health care is information that also needs to be shared with their care providers and the care delivery system. Mm-hmm. And so to the degree we've got information systems that are available through the secured portals and so forth, and that are usable by individuals in how they live their daily lives, that are informed by decades of clinical information, and that actually populate the record for care providers as they're making decisions, I'd say, yes to you, and let's take it a step further and connect it with the care system.
Right.
But I think the issue is not going to be the information. It's going to be, again, the ability to empower the consumer to be able to use it and to provide those tools. And a prime example would be, I mean, information is powerful, so I think that you cannot, nor do I see in the future us backing off away from electronic medical records. I think it's here to stay. It'll become more robust. But again, it is looking at a set of prescriptions you may have, and the tool that you would want is, I'm in a group health system, so you're always getting generics, which is really, really good. They work, and they're less expensive. But that will be one of the things that we know this country has to face is what proprietary drugs work and what generic drugs work. And the ability will be able to have the tool, because somebody's going to develop it, that allows you to actually go into your records and determine whether or not you should have been on a generic or whether you had negative interactions with them. So I think that it'll provide an incredible foundation of data. I think it's going to be the extractive tools that are going to be the power of that record.